Lastly, I'd like to introduce Hal Shea, our Director of Facilities, and Angela Mangini, our North-Site Operations Manager, to give you folks an update about the expansion that we're currently undertaking with our North Site.
Thank you, Bob. Good morning. I'm very pleased to be able to share with you a few of the stops along our journey to construct a new addition to our 150 Park Street location and to continue with that project and renovate the existing building. Back in 2008, the Health Center management began to focus on the expansion and renovation of the 150 Park Street project. The program evolved into a multi-phase project that consisted of the addition of a new parking area, a new parking lot, the actual addition to the building, and a continued renovation of the existing building. To give you a little history of the buildings that we're involved with, right across the street was the Assumption of the Blessed Virgin Mary Church. You see, it was founded in 1887. And about 62 years ago, the Archdiocese bought the property directly across the street from the church, which is 150 Park Street. And they constructed a 10,000 square foot brick and masonry building, which became the Assumption School. 26 years ago, the Health Center purchased that building and renovated it into our first owned health clinic. Consisted of about 15 exam rooms. At that particular time, it was the first owned building that we had. We originally started several years before that in the second story of a funeral parlor on Bradford Street here in Lawrence. In November of 2009, after obtaining all of the necessary permits and approvals from the city and the state, we were fortunate enough to be able to purchase the church property that had been unoccupied for several years. And we proceeded to prepare that building and the other support buildings. They were all wood frame for demolition. And in doing that, we had to obviously remove all of the asbestos-containing materials, floor finishes, asbestos-containing pipe coverings and what have you. And we proceeded with the demolition, which was a huge project. In the spring of 2009, as you can see, the building is down. We very successfully raised that property. Did the necessary site work for the appropriate drainage, and created and opened a 75-car parking facility on grade to support the new building that we plan to build at the 150 Park Street site. Just shortly after we opened that parking facility, we went across the street, and you can see we started to do the required site work for the new building. What is shown there is we had ground the original bituminous concrete surface that was the parking lot, and we had the equipment in there preparing to excavate the site for the foundation. The project was funded by a $1.5 million federal stimulus grant, which was a very significant contribution. The building that was planned, as you can see here, was planned to be 5,600 square feet. It exists there with the installation of the foundation, and we were preparing that site for the below slab plumbing. And then in July, just shortly thereafter, we had the official groundbreaking, and we began to prepare for the erection of the steel. So in September of 2009, the steel framing, as you can see, was complete, and the roof was almost tied in. And our incentive was to move as quickly as we could through this particular phase of the project so we could make the building tight, so we could continue construction with the interior work. All of the petitions and mechanical installations that we have to do. In December of 2009, you can see the building basically is weather tight. We don't have any roofing, or we don't have any windows in, but it was tight enough so we could heat the building and continue with the interior construction. And in April 2009, this is the main lobby. We completed the entire project and opened the building April 12th of 2010. And it has been a marvelous improvement, I think, to all of the folks at Park Street. And I'd like to present Angela Mangini, the practice manager at Park Street, to fill us in a little bit about her comments as how the project went as it unfolded.
Good morning. I think I've been brought here for some comic relief and to let you know just how enthusiastic we are about the new Park Street site. I'm so excited about it. I went there expecting you all to be there so I could take you for a fabulous tour of our beautiful new facility, and I was alone with the patients. So unfortunately you won't be able to see firsthand. How beautiful is this? I'm sure many of you have been to the original Park Street site. It's one thing to take a blank sheet and create something. It's something else to take a much older facility, it was once a school, and convert it into something this beautiful. So exciting. Staff was so enthusiastic that even through the entire construction process, never had a decreased number of visits, never had to shut any of the facilities. Everyone who needed to be seen was seen, and that includes a laboratory renovation that's happening right now. We're able to keep the laboratory going, so it was very, very, very convenient for our patients. I believe, and this is just my own perception, that patients think it's better care. And if you go into a brand new, beautiful building, of course, there is state-of-the-art equipment for the providers. One provider tell me I can see every single hair in this individual's ear. They were so excited to have new equipment. The patients are delighted to be there. So I just wanted to give you some thoughts. This is the waiting room. Two separate areas because it's an L shape, so there's two separate parts of the building. This allows much smoother operations. Patients, when they register, are directed to one side or the other. There's a television at each side of the lobby, so that perception of wait time is also reduced. Also, should we find that we have another H1N1 situation, we can separate folks who are ill from folks who are healthy and just there for their normal visit. So we're pretty excited about that. Not only do we have separate areas in the outside wait rooms, but once you do enter the clinic, there's these little ante rooms. So patients really feel that they're in the process, that they're moving forward, and a perception of a wait time is reduced. You know where you are in the process. So that's been very, very helpful. The additional 15 exam rooms will bring that Park Street site up to 27 exam rooms, almost doubles what we have now. We have 5 primary care providers. By the time those new provider panels are filled, we should be seeing approximately 6,000 new patients. Really help to address the demand from the community to us for these services, so we're very excited. Diane and Patrick had spoken to you about our full-service pharmacy. What they didn't mention was what a wonderful, wonderful benefit it is for our employees. Our employees also get medication at a reduced cost. A lot of young mothers, a lot of babies. It keeps our employees able to work because they can just get that medication here, the providers here. So it's really hugely convenient for the population and our patients, but also for our employees. And then increased capacity for walk-in treatment to alleviate sick room visits for non-urgent care. You know, a sick visit, you think about, go in, you see the doctor, you walk out, it doesn't really matter. But we find that continuity of care does really matter. When you go to see your provider, this provider knows your health history. Our patients have many, many, many comorbidities, and this allows really better health care because not only